Bob, I think, as the President indicated at this forum, that competition across state lines certainly was an appealing idea. It's got some complications in it because it's historically been run by the states, as we all know. But we thought that that had some merit to it. In fact, we believe the exchanges facilitate that happening.
And why don't you make it happen?
Pardon?
Why don't you make it happen?
We believe the exchanges facilitate that happening. We also believe that we want to pursue small business co-ops that was talked about in terms of letting small businesses come together so they can have a large group rather than a small group. Very frankly, that's what the exchanges are about. That's what access to the exchanges for small business do. Let me make a point about cost that Marcia raises, because clearly cost, as Kent Conrad pointed out, is going to be driving this debate. We cannot sustain the cost curve that we're on. One of the things that we know that, Marcia, whether you compete across state lines or within the state, you're paying about $1,100 for people who aren't in the system because they're getting uncompensated care. What we try to do is to wring that cost out. And as a matter of fact, as Kent pointed out, there are a lot of things that Tom and Marcia indicated in this forum that we had that we agree with, one of which was getting vigorously after fraud, waste, and abuse in the system. And we have put substantial investment in both bills to do just that, as the President has proposed.
Well, I know that's what Senator Coburn talked a lot about. In fact, the President nodded in agreement on several of the things that Senator Coburn said. He said we need to put, what was it, Senator, undercover agents into the hospitals to find out where this fraud is going on. What was that about?
Well, Bob, let me go back and just summarize for a minute. One of our problems is we don't spend too much on, it's too little on health care. We're spending too much. We spend twice what any other country spends. And the very idea that we would create another $1.3 or $1.4 trillion worth of expenditures over a 10-year period when we're not addressing the real disease. We have over $180 billion worth of fraud every year in the healthcare system. That's second only to the defensive medicine costs. So if you had a bill that just did those two things, you went after and changed the tort system, and you went after fraud, you could cut everybody's healthcare costs in this country about 15–16%. And that's all you need to do to start. So the cost, if we can't have a bill that adds more cost to health care and more government. The government is responsible and in controlling 60% of the health care today.
Let me just
if more money and more government were the answer, we would have fixed health care a long time ago.
Let me just ask Senator Conrad, then, why not just do those two things, Senator?
Because it's not enough. Look, Senator Coburn is right. I believe that reforming the tort system would help. But the Congressional Budget Office tells us it's pretty modest. $50 billion over 10 years when we're going to be spending $30 trillion over that period of time. So, yes, it's positive, but it doesn't solve the problem. Fraud would help. We think there's probably 10, maybe even 15% fraud
attacking fraud
in the Medicare system. Yeah, attacking fraud, going after fraud would be very useful to do. But it doesn't solve the problem. Tom said himself, we're spending twice as much per person as any other country in the world. And we're in a circumstance as a share of the economy, we're spending far more than anyone else, and we can't afford it. So yes, cost has to be a central concern. But you know what the experts told us? The experts told us the thing that would really matter is reforming the delivery system. Instead of paying for procedures, to pay for quality outcomes. And in the Senate bill, we begin that very approach. The accountable care organizations like Mayo, like Cleveland Clinic, that are effectively controlling costs and getting the best quality outcomes would be given an incentive to have other systems adopt their best practices. That's in the Senate bill.
All right, I'm going to let me just take a break here, and we'll come back to this point and talk about some of the practical things that are going to happen at the Capitol if anything either does get done or doesn't. So we'll be right back.